Hi, my name is Wesam Ismail. I am at the University of Iowa College of Pharmacy Division of Health Services Research, and I received the PhRMA Foundation Predoctoral Fellowship in Value Assessment and Health Outcomes Research. So my PhRMA Foundation funded project focuses on the safety of a group of medications that are being used in children at time of kidney transplant. These medications help to save the newly transplanted organ. However, they would weaken their immune system. That said, this will increase the risk of infections in those kids. And so far, we don't have much information or much evidence about the differences in infection risk between the different medications or different drugs that are being used in children. So we aim to compare the different medications that are being used nowadays, and we want to see which medication has a higher risk for infection versus which one has, let's say, a safer or a better profile. We will use data from different transplant centers throughout the US from 2007 up to today. We will be able to compare different patients with different medications and reach to a point that we can say that this medication is better for this group of patients and that one could be used for another group of patients. This project will be able, hopefully, to help physicians and clinicians to choose a safer medication for their patients. This fellowship really means a lot to me. It's a big motivation for me to be a future scientist and a future researcher in the area. Now I know that I can submit grants. I can write one. It's usually a big box for grad students to write a grant. So now I know that I can write a grant. I might be funded one day. It also shows the importance of my research project that I'm working on nowadays, that we need to focus on children's health. So one challenging thing with working with big data is you don't know what number you will end up with. So I remember that when I started with my advisor on a project, we had this data set with thousands of patients, but we were focusing on a specific group of patients. We ended up with almost out of 10,000, maybe 100 patients to be included in this. And that's, oh no, we can't continue with this tiny number. Another thing is working also with big data is I do a lot of coding to clean the data and analyze it. And I remember the first code that I wrote, it was just missing one semicolon, and it took me maybe an hour to find it. And nowadays, I almost replace comma with semicolons when writing emails. Like it became a behavior for me. Don't forget the semicolon. I think the best advice that I received is seek progress over perfection. I think as students or as grad students, we want everything to be perfect. We want everything to be the best thing that you can do. And that's very hard to achieve. With doing research, you will have obstacles all through the way. So just keep working, don't stop, try to find other solutions, other routes, other ways to do the same thing. If you got just stuck, take a break, then rethink again, but don't seek perfection. For the future, I hope that I can get a position as a researcher or as a scientist in a research institute or at a university. I have some passion for teaching, so maybe a college position or a professorship at the university will be a good fit for me. But I'd like to keep building my researcher profile and grow up in this area.